Hello everyone. Today's topic we are going to learn is about adverse drug reactions. So it is commonly known as a short form ADR, that is adverse drug reactions. Adverse drug reaction is defined by WHO, that is World Health Organization, as a response to a drug which is noxious and unintended and which occurs at doses normally used in man for the therapy of disease. So it is a standard definition, and whenever it is asked, you should write the quoted definition only. So it simply says that it's a reaction to a drug, right? So reaction can be either noxious or unintended. But this reaction is to what? It is to the doses of the drug which is used in a normal range, that is a normal dose used in a particular individual, which is used for the treatment of a particular disease. So in such cases, such reactions if observed, then it is called adverse drug reaction. Now, how are they classified? Any chapter you will learn in pharmacology. So the first thing you will learn about the drugs itself, and then the next you will learn about its classification. So similarly, ADRs are classified. I'll frequently use the term ADR, which will mean adverse drug reaction. Similar terminologies are there, like adverse drug events. So, but commonly used terminology is ADR, that is adverse drug reaction. So how are they classified? They are classified into 5 types, as you are seeing: type A, type B, type C, type D, and type E. So type A ADR means augmented. A for augmented. Type B for bizarre. Type C for chronic. Type D for delayed. And type E, end of treatment effects. End. E. So what are type A? These are the augmented adverse drug reactions, in which you can see expected undesirable effects. In which you can see expected undesirable effects. So what can those be? Those can be side effects, secondary effects, and toxic effects. So these individual effects we will be learning shortly. Type B ADR, that is bizarre type of ADR, these are unexpected undesirable effects. Type A were expected undesirable effects. Means expected means you know that you're giving particular medicine, particular drug, and you're going to get the effect which is apart from the therapeutic effect which you want. So that is expected undesirable effect. And type B is unexpected, means you're giving the medication and we don't have, or the doctor doesn't have any idea about the effect which is getting produced, the side effect which will get produced. So these are kind of type B ADR, that is bizarre adverse drug reactions, which are hypersensitivity or allergy, genetically determined adverse drug effects, and idiosyncratic response of unknown etiology. Third type of ADR is type C, that is chronic effects. So whenever the drug is used for a long duration of time, the patient will get, or the individual will get, chronic effects. Type D, delayed effect, means even after stopping of the treatment or even after stopping of the drug, the patient or individual exhibits the effects, that is called delayed effects. And type E, that is end of treatment effects. Okay, the name itself suggests at the end of the treatment, whatever the effects are produced which are undesirable, Those will be type E ADRs. Now we will study one by one. Now type A ADR. We have seen type A means augmented. The first point itself, it said that it is an augmented effect. Augmented means increased type of effect. So whatever the effects are produced, whatever the therapeutic effect is produced, so if it is in an increased potency, that will be a type A ADR. So these effects are generally expected undesirable effects, as I've already told you. These are predictable ones. Dose dependent means if we decrease the dose, the side effect will get decreased, ADR will decrease, and if we increase the dose, the ADR will increase. Incident rate is quite high as compared to the other types of ADRs, and mortality is very low. So these are not very serious kind of ADRs. Reduction in dose can minimize these adverse effects. So what is the treatment of type A ADR? You need to reduce the dose. So we have seen there are three types of ADRs in type A, that is side effect. First one is side effect. Side effect are nothing but undesirable effects. We very commonly use this terminology that what are the side effects of these drugs. Okay, so side effects are nothing but undesirable effects observed even with the therapeutic doses of the drug. For example, promethazine, which is an antihistaminic, has an anti-allergic action. Okay, it is an H1 antihistaminic drug which is commonly used for allergic conditions. But it produces sedation at the therapeutic doses. Okay, so while prescribing such drug or any drug, you are expecting side effect, you have to weigh the risk of the side effect and against the treatment of the disease, what he is suffering from. Many times what happens that some anti-cancer drugs produces bone marrow suppression, which is a very bad side effect. But still we prescribe anti-cancer drug to cancer patients, because in such patient the treatment outweighs the risk of getting side effect. And here, while prescribing promethazine, some patients might not accept that no, I don't want sedation type of side effect because my work is a heavy kind of work. So kindly prescribe me some other drug. So you have to weigh the risk versus benefit of the drug. So this is a side effect. Second ADR under type A is secondary effect. Secondary effects are nothing but the indirect consequences of main pharmacodynamic action of the drug. Now till now you have gone through pharmacodynamics and pharmacokinetics. Okay, so pharmacodynamics means what the drug does to the body. Okay, so whatever the drug is doing to the body, it is an indirect consequence of the drug. The secondary effect is, for example, development of superinfection after suppression of bacterial flora by antibiotics. Okay, antibiotics, you must have heard this term, antibiotics. Any infection, any respiratory infection, any urinary tract infection, any kind of infection, we treat such infections with antibiotics, okay, which kill the microbial organisms. So when these antibiotics are taken, ingested orally, so you also must be knowing that in our gastrointestinal tract there is a normal bacterial flora which is important for some other mechanisms, which are very, very essential for the normal metabolism, for the normal health of the body. So if we ingest antibiotics for certain infection, these antibiotics kill the microbial flora which is present inside the intestine. The commonest example is tetracycline. So this is a secondary effect to tetracycline, to the antibiotics. Many of the antibiotics produce such effects. Second example given is decreased host defense due to corticosteroids. Corticosteroids are the agents which are potent anti-inflammatory agents. These are given when there is kind of inflammation and many other things. They are also given for allergic conditions. They have various uses. So, but when corticosteroids are given, it causes decrease in the host defense mechanism. So that is again a secondary effect to corticosteroids. Now third ADR under type A category is toxicity. And due to the name itself suggests that it is due to overdose or after prolonged use of the drug. So bleeding due to high doses of heparin. Heparin is an anticoagulant which will inhibit coagulation. So if the coagulation is inhibited, if it is stopped, then there will be more bleeding. So if we give more dose of heparin, there will be increased bleeding, right? So this is a toxicity to heparin. Another example is paracetamol-induced hepatotoxicity. So paracetamol is a simple analgesic antipyretic drug. If it is given repeatedly or overdosing of the drug is there, then it will cause hepatotoxic effect. Okay. Now the next type of ADR is type B ADR. These are bizarre kind of adverse drug reactions. Bizarre means unexpected. We can't expect that such kind of effects can be seen to this particular drug. So these are unexpected, undesirable effects. These are non-dose dependent. Okay, as we have seen in type A, which were dose dependent, type B are non-dose dependent. Its mechanism is unrelated to its main pharmacological action of the drug. Again, as we have seen in type A, the side effects, secondary effects and toxic effects were dependent on the pharmacodynamic action of the particular drug. In type B, the adverse drug reactions are unrelated to its pharmacological action. This is nothing to do about its pharmacological actions. And reduction of the dose does not reduce type B ADR. Again, likewise, we have seen in type A, the treatment of type A ADR was reduction in the dose. In type B, you cannot reduce the dose to stop the reaction. You have to stop the drug if you don't want the reaction, and if you have to change the drug. We'll see type B ADR. The first is drug allergy. Now, drug allergy, there are different types of, again, types in drug allergy. That is type 1, type 2, type 3, type 4. Type 1 is immediate type, which is also called as IgE mediated. Type 2 is cytotoxic. Type 3 is immune complex mediated. And type 4 is delayed type, that is cell mediated. Now in type 1, which is IgE mediated, you must be knowing all the antibodies. There are 5 types of antibodies: IgG, IgA, IgM, IgE and IgD. So this particular type 1 reaction is mediated by IgE type of antibody. So your drug acts like an antigen. So drug which is acting like an antigen causes formation of IgE antibodies. So antigen, that is drug plus IgE combination, binds to mast cells, leading to degranulation of mast cells with the release of histamine. Histamine is present inside the mast cells. You must have learned this in physiology. So the picture itself suggests the IgE and antigen, that is a green Y-shaped structure you're seeing, which are antibodies, and the yellow structure you can see is an antigen. Okay, so this antigen antibody complex is binding over to the mast cells, and then degranulation of the mast cells is occurring, inside which there can be histamine and other mediators. Okay, and it causes allergic reaction. How will you manage this type 1 hypersensitivity reaction? Type 1 hypersensitivity reaction are generally treated with normal antihistaminics. So if histamine is liberated, then antihistaminic is given. But sometimes the reactions are very severe and lethal sometimes. So these reactions are like anaphylactic reactions. So these anaphylactic reactions are very lethal kind of reactions. So the drugs given are injection adrenaline, injection hydrocortisone, and injection diphenhydramine. So injection adrenaline, you will be learning this drug soon, that is in autonomic nervous system. It is a sympathetic drug. It is an adrenergic drug, and adrenaline is a very good physiological antagonist of histamine. Now this you must have learned in antagonism, in the types of antagonism and pharmacodynamics. So there were different antagonism, that is physiological, pharmacological, chemical, physical. So physiological antagonism is bestly exhibited by adrenaline and histamine. Okay, so whatever the histamine is liberated, it will be antagonized with the administration of adrenaline. Okay, physiological antagonism, to tell you quickly about that, is physiological antagonism means one drug is producing certain physiological actions and you're giving the another drug which is a physiological antagonist, so it will produce the exact opposite physiological actions to the as compared to the first drug. Okay, so adrenaline, again I'm repeating, adrenaline is a physiological antagonist of histamine. So it is either given by IM, mainly it is given by intramuscular route. If it is given by IV route, it can be dangerous for the heart. Next drug, injection hydrocortisone, which is a glucocorticoid. Okay, so this will alter the immunological reaction which is happening. And the third drug, diphenhydramine, it is an antihistaminic drug which will directly antagonize the histamine. Now type 2 allergic reaction is cytotoxic. Now the blue circle you can see is a platelet, and the small yellow molecules you can see is a drug which is also called as haptane. So drug binds to platelet, forming a haptane platelet complex. Okay, now this complex binds to the anti-haptane antibody. The Y-shaped structure, again green color you can see, is an antibody. So this haptane platelet and antibody complex formation will lead to liberation of the substances which are present in the platelets, platelet destruction. So that's why it is called as cytotoxic. Cyto means cell, it is related to cell, so it is toxic to cell. Now the type 3 reaction is the immune complex reaction. On the left side you can see it is a blood vessel, the basement membrane, that is a membrane of the blood vessel. The outer layer is the basement membrane and the inner layer is endothelial membrane in which you can see endothelial cells. Okay, and to these endothelial cells attached is the immune complex. Immune complexes, that is the first one I am reading, that is immune complex, are deposited in the wall of the blood vessel. Okay, so again a green Y-shaped structure is an antibody, and the yellow circles are antigen. So this is an immune complex. So the presence of immune complexes activates complement and attracts inflammatory cells such as neutrophils. Okay, so these immune complex attached with neutrophils, their reaction causes again liberation of lot many inflammatory mediators, and this can damage the endothelial cells of the cell membrane of the vessel, blood vessel. What is type 4? Type 4 is a delayed type of allergic reaction, and it is a cell mediated. Okay, so type 1, type 2 and type 3 we had seen they were antibody mediated, and type 4 is a cell mediated reaction. So first foreign antigen enters the body, that is our drug, which acts like an antigen. Then macrophages go and attach to the antigen. This macrophage present antigen to T lymphocytes. So there are basically two types of lymphocytes, B lymphocyte and T lymphocytes. So B lymphocyte are responsible for the production of antibodies, and T lymphocyte is responsible for the cell mediated immunity. Okay, so these macrophage present antigen to T lymphocytes. So these T lymphocyte becomes cytotoxic T cells. So here occurs autoimmune reaction. Cytotoxic T cells attaches to the similar antigen in the healthy tissue. The T cells which they have identified as an antigen on the macrophage, externally administered antigen, they will identify similar antigen inside our body on the normal tissues, and they will this cytotoxic T cell will bind to normal antigens present on the normal healthy tissue cell, and they will cause their destruction, inflammation. So the normal cell is affected. Okay, so this is what is type 4, that is cell mediated or delayed type of allergic reaction. These are again the type 1, type 2, type 3, type 4 and their differences. We have seen these reactions in detail. So we will go further. So management of hypersensitivity reactions. We have seen management of type 1, that it is managed with adrenaline, corticosteroids and antihistaminic drugs. So type 2, 3, 4 hypersensitivity reactions are generally treated with glucocorticoids. Okay. Now next reaction is genetically determined abnormal response of a drug, which is also called idiosyncrasy. Okay. So the example here it is given is a reaction occurring because of the presence of atypical pseudocholinesterases. Okay. Now acetylcholine is a normal neurotransmitter present in the parasympathetic nerve endings. This is metabolized with the help of cholinesterases. Okay, so true cholinesterases are present at the synaptic junction. Okay, but pseudocholinesterases are present inside the plasma. Okay, so when there is a presence of atypical pseudocholinesterase, it will not metabolize the drug called succinylcholine, which is quite similar to acetylcholine in its structure. Okay, so the neuromuscular blocking action of succinylcholine is terminated within 5 minutes by the hydrolysis due to presence of normal pseudocholinesterases in plasma. What happens normally when we give succinylcholine as a muscle relaxant, it's a muscle relaxant, to a patient, it has a very quick duration of action, that is, the action lasts up to only 5 minutes. Why? Because this succinylcholine gets metabolized by pseudocholinesterase, which is present in plasma. But if the patient has atypical pseudocholinesterase, which is because of genetical abnormality of that particular patient, a different genetic makeup he has, so that succinylcholine will not be metabolized in that particular individual, and it will produce a prolonged effect, that is, a prolonged bronchodilation will be there, and patient can land up into apnea. Okay, he will not be able to breathe properly. So what are idiosyncratic drug responses? These can be harmful, as just we have seen about succinylcholine, occur in only small minority of the individuals. These are not very common reactions, as we have seen about the side effects. The cause of this particular idiosyncratic drug responses is poorly understood. Is just understood that it is because of abnormal or a different genetic makeup of that particular individual. Another example of this is occurrence of aplastic anemia with a single dose or low doses of chloramphenicol, which occurs in approximately 1 in 50,000 patients. Okay, so aplastic anemia means it's a type of anemia where there is no cells, or there is a the cells get depleted automatically because of the drug. Okay, and it is with the use of chloramphenicol, which is again an antibiotic. So this effect is seen in 1 is to 50,000 patients. We have covered type A and type B. Now what are type C? These are chronic effects. That is chronic effects, chronic ADRs, chronic adverse drug reactions. These are associated with prolonged use of drugs. For example, Cushing syndrome is there after the chronic use of steroids. Okay, so if particular steroid is used for a prolonged duration of time, then it can cause Cushing syndrome. So what is Cushing syndrome? The symptoms and signs you can see on the right hand side on the picture. That is, it causes moon face, dark facial hair, cardiac hypertrophy, obesity, abdominal striae, amenorrhea in women, skin ulcers, poor wound healing because of muscle wasting is there in the extremities, osteoporosis, that is weakening of the bones, and buffalo hump because of the fat deposition. So these are very common symptoms to the prolonged use of corticosteroids or steroids. So in such cases, you should alter the doses of the drug according to the condition, according to the response of the patient. So you have to monitor continually that if the patient is suffering or if the patient is showing such kind of symptom. So you have to change the medication, you have to taper the dose, you have to monitor the symptoms. What are type D? These are delayed effects. These occur after a long time after treatment. So secondary cancers in patients treated with alkylating agents for Hodgkin's disease. Hodgkin's disease is a type of cancer. Alkylating agents are a type of anti-cancer drugs. So if such drugs are given for Hodgkin's disease, secondary cancers can get developed after a long time in those patients. Our fifth and last type is type E, that is end of treatment. These occur when the drug is suddenly discontinued. So such effects can be seen with the use of propranolol. Propranolol is a beta blocker. It is a commonly used drug for hypertension. So it is an antihypertensive drug. So hypertension is a kind of chronic condition in which you have to give the particular medicine for a very long time. So if you're using propranolol in certain patient, you cannot stop propranolol as such. Sudden stoppage of drug cannot be done. Otherwise, there would be rebound hypertension. Okay, and another complication can also be there. So you always have to taper the dose of the drug which you are using from a chronic basis. From the long duration, if you are giving the drug, you have to taper the dose of the drug and then stop the treatment. Okay. Another reactions in adverse drug reactions are photosensitivity. It is a cutaneous reaction resulting from a drug-induced sensitization of the skin to UV radiations. The reactions are of two types, that is phototoxic and photoallergic. What is phototoxic reaction? This is more common as compared to photoallergic type of reaction. In phototoxic reaction, the drug and its metabolite, I'll repeat, drug and its metabolite accumulates in the skin, under the skin. They absorb light and they undergo a they undergo a photochemical reaction. Okay, so these result into local tissue damage, a sunburn like reaction. For example, erythema, edema, blistering can be there. And the common drug causing these phototoxic reactions are tetracyclines. These are antibiotic drugs. And the second type of reaction is photoallergic reaction. Drug or its metabolite induces a cell-mediated immune response. They produces a contact dermatitis like picture. You must be aware of contact dermatitis, very commonly seen with females, that they use gold chain or some artificial jewelry. So some females or some girls are allergic to such kind of jewelry or gold ornaments or any kind of ornaments. So they produces a particular allergic response to that particular site where they are wearing that ornament. Okay, so that is called a contact dermatitis. So photoallergic reaction is kind of a contact dermatitis like picture that may persist long after exposure. And the drug causing this kind of reaction are sulfonamides. Another reaction is drug dependence. So drug dependence can be classified into psychological and physical. There are many other terminologies in drug dependence, but we will not go into the detail. So we will stick to these terms, that is psychological dependence and physical dependence. What is psychological dependence? In this kind of dependence, individual believes that the optimal state of well-being is achieved only through the actions of the drug. Are you getting? Individual believes that the optimal state of well-being is achieved only through the actions of the drug. For example, opioid analgesics. Another type of dependence is physical dependence. Discontinuation of the drug results in a characteristic withdrawal syndrome. For example, alcohol and opioids again. Okay, means they get physically dependent on the drug. So they show physical symptoms. If the drug is withdrawn suddenly, they show physical symptoms, which are called as withdrawal or abstinence syndrome, which is commonly seen with alcohol. Another kind of reactions are drug withdrawal reactions. So sudden interruption of the therapy with certain other drugs also result in adverse consequences, mostly in the form of worsening of the clinical condition for which the drug was being used. One kind of example I had just given is stopping of propranolol in the treatment of hypertension can also be included in such kind of drug withdrawal reactions. Another example is frequency of seizures may increase on sudden withdrawal of an anti-epileptic. Epilepsy is a kind of seizures. It's a syndrome under which seizures, many different types of seizures are there. And for these epilepsies or seizures, Anti-epileptic drugs are given. And if we suddenly withdraw these drugs, the patient will land up into again another seizures and epilepsy. So you shouldn't withdraw any particular kind of drug because these will cause withdrawal reactions. Another reaction is teratogenicity. Another ADR is teratogenicity. What is teratogenicity? It's a capacity of a drug to cause fetal abnormalities when administered to the pregnant mother. The very common and epic example of this teratogenic effect is thalidomide disaster. In this disaster, thousands of babies suffered with the disease called phocomelia. So phocomelia, in the picture you can see the baby has a seal-like limbs, short limbs, or some babies were delivered with no limbs at all. Okay, so this is particularly caused with the use of thalidomide drug, and the other effects focused attention onto this type of adverse effects. So in teratogenicity, drugs can affect the fetus at 3 stages. First stage is fertilization and implantation. So this is the stage which is from the conception to 17 days. So if the drug is affecting at this particular stage, there will be failure of pregnancy, which often goes unnoticed. Okay. The second phase is organogenesis, which occurs at the days 18 to 55 days of the gestation. So it's a most vulnerable period and deformities are produced in particularly this period. The third phase is growth and development, means 56 days onwards. So there will be developmental and functional abnormalities. So the commonest drug which causes teratogenic effect are phenytoin, tetracycline and ACE inhibitors. So phenytoin causes cleft lip or cleft palate. Okay, tetracyclines causes discoloration and deformation of teeth, and ACE inhibitors causes hypoplasia of organs. Hypoplasia means decreased formation of organs. So there are different categories of in this teratogenic effects, that is category A, B, C, D and X. So this chart is there in your book. You can very well read this chart and go through it. Another effects we are ending towards the end of our lecture. Another effect is mutagenicity and carcinogenicity. So if the drugs administered and they are causing effects or they are hampering the DNA and RNA sequence, it will cause mutations. And ultimately it can also cause, because of this mutation, it can also lead to cancers. Okay, so the drugs are anti-cancer, radioisotope drugs, estrogens and tobacco. So these are mutagenic and carcinogenic drug. Another reaction is drug-induced diseases. These are also called as iatrogenic disease or physician-induced disease. Okay, for example, NSAIDs, that is non-steroidal anti-inflammatory, amongst which salicylate. Now, salicylate means aspirin. Okay, aspirin, Disprin is very commonly used drug for as an antipyretic or analgesic drug. Okay, so if we give aspirin, acidity problem can be there very commonly. Okay, and if it is used regularly, then the patient can develop peptic ulcer. So this is a physician induced disease, that if the physician is prescribing salicylates or NSAIDs, that is non-steroidal anti-inflammatory drugs, then the physician also prescribe the drug which will decrease its acidity, antacids, or there are certain other drug which will decrease the acidity or decrease the side effect of these salicylates. Otherwise, it will be called peptic ulcer induced by salicylate, and this will be physician induced, that is iatrogenic disease. Hope you have understood all the adverse drug reactions that I had told you today. So go through the textbooks and read the chapter well. Thank you so much.